So I'd like to welcome you to the 6th Annual Metro North Health Forum, jointly hosted by Brisbane North PHN and the Metro North Hospital and Health Service. Today's forum will highlight a range of initiatives underway between Metro North HHS and the Brisbane North PHN that aim to connect and coordinate healthcare.
And the aims of this project is really to trial an integrated community response falls pathway that enables post-falls management and care coordination for the older person who falls at home but does not require transport to the emergency department and local hospital.
I have a passion and an intention to share with the public and you, the health professionals, the importance of a Health Alliance, their accomplishments and their aspirations.
This program was a response to the higher than national average presentation of young women under the age of 20 who are presenting to Caboolture Hospital. So what we've learned that we need to make each appointment count. We don't want it to be this really quick, tight process of women. We need to build relationships and we need to do opportunistic education.
I just wanted to anchor us back in what we see as the very important things that we're trying to achieve, at least from the PHN's point of view, and that is in that center circle. Very importantly, it's about the consumer and the consumer's voice at the center of everything that we do, driving and leading the changes that we're actually looking to achieve. And then associated with that is reorienting the health system toward care in the community, and I'd actually change that now to be care closer to home, because that's kind of what we're all trying to achieve, and also making the best use of those limited resources that are out there.
We recognise that as a leader in many health fields and as a provider of a significant proportion of Queensland's public health care services, we have a responsibility to innovate and continually invest in our future to ensure we can provide excellent care. And that investment needs to include our partnerships such as with the PHN.
And the area that's most progressed is in the care of older people, and what we've seen is increasing engagement by the sector, local sector interest in this, and ideas being generated about how we can improve care for older people.
So using the planning framework, one of the things that I think the PHN has done brilliantly is they've actually been able to take their funds and allocate it where they need it, and this has been backed up by the planning framework. For example, under the Better Access scheme, which provides cheap or free psychological services for people, most of those resources are heading north because, as I say, down this end at the Royal Brisbane end, the population has adequate access to psychology needs.
We spend an inordinate amount of time helping other people to help themselves. Could we cognitively think about that and see these ideas in familiar new ways? Occasionally you could put on yourself and discover that it would be a good idea if you listen to what you tell your patients.
All of those questions we could ask of ourselves. Are we kind to ourselves? Do we try and understand our own journeys? Because in understanding our own journeys, we have the capacity to listen and to understand other people's. Are we honest and respectful with our own selves, and are we curious about our own situation? Because the capacity to be self-reflective in that way is exactly the capacity we need to provide good care to our patients.
And I think you'll agree with me that we've had a wide range of discussions, not only in this room through plenary sessions, but in our exhibition hall. Thank you to all of you who attend our forums every year. I think I heard Abby say earlier this is the 6th one, and certainly we value the opportunity to network, to share, to converse with our stakeholders, not only with the Hospital and Health Service, but across the whole primary and community care setting. So thank you to you for also attending today.